one of the attendance possibilities, and we might even have to put that off the fall, but we're gonna shoot you with trying to send a good picture of some of it. But I'd like to welcome everyone here and glad to describe the storms so far. With that, it's time for prayer. Mr. Moody, can I count on you to give us a line?
Yeah. Right with me. Our divine Heavenly Father, Lord, we thank you for your love, your mercy, and your grace that you show each and every day that's your life will be in you. Lord, we just thank you for each member of this board and for each employee that they help upon and the opportunity that you give us to serve the people in this city. Lord, we just thank you so much for the season that we've just gone through. And we remember most about that terrible Friday. But thank you, Lord, that Sunday was coming. Lord, we just ask that you go with us through this meeting and each and everything, that every decision that's made will be based on your will. Lord, we pray for our legislature, and we know the difficulties that they go through trying to do the best they can for the citizens of the state of Mississippi. We just ask that you lead and guide them each and every day. Lord, most of all, we thank you for sending your son Jesus in the world, and through our belief in him, we might have life and have it everlasting. Ask you to forgive us of our many sins and shortcomings. In Jesus' name we ask. Amen.
Y'all would stand for the pledge.
Pledge allegiance to the flag to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First item on the agenda is the approval of minutes from January 10th and January 19th, special call meeting. Has there been time to, review those minutes? Is there a motion to approve them?
Second.
There's a motion and a second to approve both sets of minutes without, any corrections. All in favor, say aye. Any opposed? All right. Who seconded? Dr. Anthony. Records all time. All right, Dr. Edney, are you ready?
Yes, yes, sir. Thank you, Mr. Chairman. Good morning, board members. Thank you again for your service to the state of Mississippi and to Mississippi State Department of Health. We do appreciate what you do, and we have a couple of our board members that have been impacted by the severe weather. We appreciate everybody taking the effort to be here. If you remember, April tends to be our meeting with a lighter regulatory agenda. So I'll take the opportunity to make sure you're up to speed with the work of the agency and some of the victories of public health, and have an opportunity to answer any of your questions. You know that we are in the legislative session still. This is our long year, it's 120 days. We have just under a month to go. And health has been a very important topic, as you know, and it has kept us busy and engaged throughout the whole session. But I've been very pleased with our interaction that we've had with leadership and legislative force in general, and the amount of consultation that we've been able to provide, and definitely the receptive, positive reception that we've had with issues related to public health. I do want to, and we'll give you a legislative review in just a second. We want to give you just a quick epidemiology update. Not a whole lot going on, thank goodness. The flu season is waning down nicely. COVID has come down as well, so we're not seeing any stress on the healthcare system at this time. I do want you to have the awareness of something nationally, importance, and that's H5N1 outbreak that's occurred in Texas, Kansas mostly, but some of, some of the western states where they have heard H5N1 is a version of avian flu, and it's hit poultry again, part of the country, but in Texas and Kansas, they jumped from poultry to dairy cows. And then, one case in Texas documented that it jumped into humans. There has not been a significant human outbreak, but it's gotten the CDC's attention, and, all the states have been alerted. I'm in friends with Dr. Jennifer Shue, with the state health officer in Texas, and she's been keeping us apprised of what they're going through. And thankfully, the cows are recovering well, none had to be slaughtered, and the one human case was fairly mild. We've had a good opportunity to work with the Commissioner of Agriculture and his team, and especially the state veterinarian, and it's been good cooperation between their agency and ours. We've not had any issues, so we're just standing really. Should that become an issue? The issue of congenital syphilis continues to be a high priority for us. We did come in at the final numbers for 2023 higher than 2022, but the rate of rise was significantly lower. So when you go back to 2018, 19, and leading up to the surge in syphilis, we're seeing the slope start to decline. And Dr. Taylor reports the first quarter of 2024 looks better than the first quarter of 2023. Still too early to make a final determination, but we are seeing some glimmers of hope that our work of our market is paying off. I want you to know that we are leaning in hard to the syphilis surge, especially the congenital syphilis issue. We have been promoting testing. The regulatory changes that we made last year are definitely making an impact. Testing is up, and we are really working to facilitate the treatment. We have 9 designated specialists that are in the pipeline now. And I think that our workforce for DIS, just because of funding cuts, including federal funding cuts, was down to just a third of what it should be. And we have been working hard to rebuild that workforce, and we're getting there. We've been working closely with our partners, including student population health, Dr. Dobbs' team at UMC, and the Public Health Institute, and our other community partners. We have been working aggressively on appropriate communication to impacted communities. The heat map for syphilis is pretty extensive regarding the impact of the counties. But we had, I think, a very successful town hall at Jackson State yesterday. We're working to coordinate that at all of our universities, although the university counties are hotspot counties. And then we are doing, Lauren and our communications team is doing targeted media messaging regarding syphilis and congenital syphilis into the impacted communities, using health literacy in an appropriate fashion to get the message to where it needs to go, and try to help, especially pregnant women, be protected from syphilis. We have been engaging our community health workers in this space, and especially with the high-risk perinatal space, with Dr. Sutton and his team is engaging with community health workers to work on the health and lung population to make sure that the women we care for that are documented high risk, that they are being tested, and that we definitely are closing, believe that they syphilis issue for a couple of years. So any questions for the epidemiology before, those are the hot buttons that we're dealing with right now.
We should have some cases of measles in schools. Do we have a plan and do we have the authority to restrict certain students from attending or what would be what would be our response?
Yes, sir. And we actually were talking about that Monday morning with our executive team. They very recently, there was a serious outbreak in Broward County, Florida, that made the news. What wasn't quite as public is that there were cases that traveled from there to New Orleans and caused a small outbreak in New Orleans, which was very close to home. But Louisiana Department of Health contained that very rapidly. Another outbreak in Georgia related to the Florida cases, and they responded very quickly and contained that. And right now, there's an active outbreak in Chicago that's unrelated to the other outbreaks we've seen. So it's getting close to home. Our vaccination rates are still exceedingly high, still above 98% among our school-age children. So we're still having a significant population of immunity that I think will persist for quite a while. That our concern is populations, clusters of unvaccinated children that may be attending school together, that monitoring those areas. And so far, we've not had any areas of concern. We do still have, we retained our public health authority to manage measles outbreaks like we manage any outbreak, and that included we put before the federal judge that we were maintaining our full public health authority, which he agreed, but that included quarantine if needed, having the exposed unvaccinated children to be at home safely, and things like that. So we have a whole different workforce that would be measles to our epi nurses would be working those, and also communicable diseases, and they would work that like they would a hepatitis outbreak or any of our communicable disease outbreaks. And so, to answer your question, yes, sir, we have the same public health strategies that we know that work, that although we've not had to apply to measles in 40 years, we'll still be able to respond quickly and rapidly and do what's necessary to protect the children.
Well, I was just concerned about the religious exemption, and then maybe some of the other children that are coming in. I don't know how many we've got of these illegal immigrants that are coming in here, but I know, I feel like none of their children would be vaccinated for those contagions.
So we, I think, Dr. Taylor, correct me, but we should be approaching between 700 or so exemptions,
It's actually just shy of 2,800.
2,800, and that includes our medical.
But that's religious,
That's just religious. Then we have another 500
500 to 600 enough.
to medical exemptions. So we still have families that are seeking medical exemptions appropriately as they always have. And then those seeking religious exemptions. And in the school system right now, there are 700 or so. How many are in schools?
Approximately 750 or so, in schools enrolled in K-12 with religious exemptions, and a little over 500 actually enrolled in K-12 with that. So out of the body of those that actually possess one, it's a smaller number that are actually currently enrolled.
And we'll see those numbers, I expect, each year gradually go up until we have the students start graduating. And I hope that they're going to stay in state at some point. But we still lead the nation in vaccination rates of our school-age children. And then we will for at least a couple more years. And I will keep bragging on that until I can't. But West Virginia, my friend, State Health Office in West Virginia, they're being sued by the same group in the same manner. In federal court the same way. And, they survived the legislative attack, but, you know, that, you know, they have the same fight within their attorney general, doing likewise, so they're kind of on their own up there, but they have our experience to go by. It is important for y'all to understand that measles cases nationwide are way up. And Katie, I believe that doubled compared to 2022.
But for 2024 so far, it's doubled in 2023, when we're only in.
So that's good. The rate of rise for measles nationwide is going up. So I think we'll be safe for the next few years, but we're taking it seriously and being prepared. And asking doctors to brush up on their skills of diagnosing measles, because none of us have had to do it for a while. It's,
The process at the health departments with handling the emergency infections, they don't know.
biggest
So,
it is going, I'm not gonna say it's not a burden, but they're doing a great job.
Dr. Anthony, do you have a question?
No. Okay, thank you. Legislatively, and I'm not sure, just advance the slides. I'm not sure, but just go to the next slide. We can see it there. Our report of health agenda is performing well, it's applicable, everything is still alive. You can just leave that there. The Department of Health Authority, co-sections, Board of Health Authority co-sections have gone through with full support. In fact, the Senate amended it in a manner that gave a little bit more responsibility to the Board of Health, with us working with the state health plan with the new vision. And if the House conservatives, and basically we would be charged with doing what y'all, by statute, doing what y'all have been asking vision for. And then also for us to be reporting each year to legislative leadership what the findings are statewide from our state health planning work, any recommendations that the Board of Health might have based on state health plan. That was independently done by the Committee on Public Health and was well received in the Senate. Now it's we'll see if the House concurs, but no infringement whatsoever on public health authority at the Board of Health level or the state health officer level. Very pleased with that so far. Our grace law has been signed by the governor, and the Mississippi Qualified Health Grant Program is at the governor's office now. Uniform Controlled Substances Act recommendations that we have to do every year are on calendars for both the Senate and the House. You know, a lot of that is going to be happening today. And I've been working with Dr. Lampton and Mr. Moody. The Office of Radiological Health is one of our statutory fee-based programs that was severely underfunded and had not had a statutory change since 2016. And when we recognized it, we were in the hole $800,000 a year for that program that's fee-based. And we have been able to work with the right partners to get the fees adjusted to a point that gets us to break even over a 4-year period. And that's going very well. That will fund a few health departments for us. And the community health workers, it's an issue that came up right at deadline, and it's basically a bill that is empowering through the Board of Health, the agency, to be able to do the certification for community health workers as in other states, and to raise the bar in their training and their recognition and provide a pathway towards reimbursement through Medicaid for their services for Medicaid providers. And that's being well received. We'll be working closely with the division to make sure that that's a program that works well for the division budget and for our work. Mainly it will be the CHWs that work for us and I imagine FQHCs. But any of the reimbursement that we receive in the health department will pay our match. So it actually drops down more money for the Medicaid budget, as we typically do with most of our Medicaid reimbursement. But there's still a lot of work that is, it's been passed by the Senate and the House is taking it up today, I believe, and we'll work, if that should pass, and should the governor approve it, and we'll work very closely with the division to make it the right program for both agencies. CHWs are critically important for our future, for community level public health, to reduce our costs and to improve our outcomes. And this is a national model. We're not cutting edge at all. We're trying to catch up here with the 25 states that are kind of leading the way. And I'm really grateful for this opportunity. And so now it's, especially after today, it's all about appropriations. And thus far, we've the House is ahead of the Senate, and our appropriation discussions have gone very well with the Speaker and Chairman Luis, who is our subcommittee chair for our agency, have gone very well. Our ARPA discussions have gone very well, and we'll break those down for you to remind you on those again. Our appropriation hearings on both sides went very well with a lot of good feedback. And I know Senator Hobson essentiated the way we're looking at approaching public health going forward. So we and I are at least scheduled to meet in the next week or so. All right. And Mark, let's go to the next slide, if you would. Yeah. No, so that's for the FQHCs, that's the state grant money that they use that for the uninsured, the sustainability grant or bill. We have the last 5 hospitals that are going to be eligible with the current program are moving out of the pipeline now. It's about 4 million that's coming out. They come out, I expect, this week. And that will leave a balance of about 22 million thereabouts for the hospitals that were not deemed eligible. And the current bill is to allow 38 million capital expense funding to cover that. And we're very confident that would cover those who weren't eligible. And then there were a few hospitals that were eligible that not fully for their full amount. And we'll make up the difference with capital expense money, which we can push out very quickly. But we told Mr. Beard, I think we funded hospital sustainability about 60 million out of ARPA. So that was a chore, but I'm real proud of Chris and the team. We just kept pushing until we could get to yes the way we need to for the hospitals. And then we'll take care of the last few that will make. Any other questions?
It sounds like the bills addressing our request regarding the state health plan and also regarding funding for community health workers have, if I'm understanding correctly, passed the Senate and come out of House committee and presumably are on House agenda even for today. But that would be, we would hope that the whole House would take those 2 bills up and provide the statutory backing for those 2 changes. Is that?
Yes, sir. And I am concerned because the House adjourned early yesterday. So the calendar is full. And I believe we were scheduled for yesterday, most of our big meals. So I'm hopeful that, this morning, that Chairman Creekmore will be able to take care of those. I want to tell you, Chairman Creekmore, amazing to work with, been nothing but supportive of the agency, and really appreciate the support. They've gone above and beyond. Even having to, not just being the entire dealers, but everything. So and I give a lot of credit for where we are in session to our leadership and both public health. So, and there are several bills that impact us that I'm happy to comment on what I know if you have interest. These are the ones that specifically have y'all agenda or popped on the radar late in the process.
Any other questions about the legislative work?
All right, so, a couple of, let me go quickly over a few wins. First of all, Marcus wrote me down with this slide. I'm extremely pleased with our communications department. Here is a list of active campaigns that are currently on notice. And National Public Health Week went extremely well, and that was last week. I want to recognize all our hardworking health department folks for what they do in public health. Dr. Ware, we have Lab Week coming up. We'll be promoting the good work of the Public Health Lab and our health information professionals. The syphilis campaign I discussed, really pushing hard to promote the breast and cervical cancer program to get our mammogram, especially our mammogram rates up in that program. I want to shout out to Dr. Pearson and her team. First of all, Dr. Pearson is being recognized as a distinguished alum for the University of Mississippi and the pharmacy program. So congratulations, Meg. And they now in the opioid program, not only did they improve the health outcomes of Mississippians related to opioid-related deaths, but we now are statewide with our opioid treatment program. All the counties have access to telehealth with our providers, and the numbers are steadily going up with the patient base or those with opioid use disorder who are being cared for by the health department, by our providers, and the public health pharmacy providing their medications. Very, very proud of that. We have a robust campaign for prenatal care and the importance of prenatal care. We talked about yesterday about again, targeted, most impacted communities with health literate communications. They're really pushing hard to increase awareness of the importance of early prenatal engagement. We have Judy Motors here with the Vital Records team, which is a center of excellence for the agency. And it's one of the most common constituent service requests that we get. And Judy does a great job taking care of those for us, getting those death certificates proposed. But we're proud of that, and then getting ready for back to school this fall. And EMS 50th anniversary promotion, communications as a mobile app that you'll be learning about by the next health meeting. I think it's extremely helpful, and they are staying busy in the communications department. Lauren, thank you, Eugene, for that. All right. I want to say, Marshall, Morton, if you would stand. I want to recognize Marshall, who's in a suit today. Marshall is our new Office of Health Protection. Is that the new name? All right. I want to recognize Marshall on behalf of the Emergency Preparedness and Response Team for Mississippi being recognized again as a top tier state for emergency response and preparedness. And it takes a lot of work year round for them to do that. So the tornado and Rutherford was good example of what they had to do very quickly and how impactful that is. But congratulations to Marshall and his team, and Marshall, thank you. We appreciate your good work, buddy. Thanks. The, keep going, Marcus. Just see the next slide.
You know, there was a staff newsletter, and I have an interest in seeing what will come out.
Okay.
If you put the board on the mailing list or whatever that's,
So you'll do it.
very good. Y'all would like to see that. Absolutely. I think we'd be an interest, reading. Very good.
All right, Sharon doesn't have, there's nothing official to report financially because we're starting a new budget season and we're in the middle of appropriation. Sharon's here to answer any questions. I wanted to review with you quickly as we move into the formal appropriations time to remind you of where we are. And to remind everybody how our funding looks. This is how we broke it down for our legislative appropriations leadership. There are three buckets of money that flow to us from the state budget. The first bucket on the left, 34.5 million, is the core appropriation for the agency. This is the money that we use to run the operations, keep the lights on, keep the training running. And it allows us discretionary ability to pivot and invest in emergency areas, because we played whack-a-mole for public health challenges of the day. And that is the most important bucket. We have asked for a 3% increase, which basically will help us with inflationary costs and to invest in our lowest paid employees who are making down around 25,000 or less. And we just have to invest in those state employees. So we have plenty of investment opportunity with our federally funded positions, it's our state funded positions. So we're asking for a little extra help to help get our lowest paid employees up, and make sure that we don't have a widening between state and federal. And then a lot of the other resources we'll need will come out of the work we've been talking about in terms of improved revenue generation and clinical operations. Second bucket is for the direct appropriations that come to us that we use, but with a targeted approach. Their line items for tobacco, or their line item for electronic. It comes to us, we utilize that. We have the discretion how to, but it has to be in that space. Very important money. Less discretion than the first bucket, but still that's legitimate agency money. The third bucket, this is why I've broken it down. You can see it's a large number. So the 40 million, those are our pass-throughs. That's the money that is sent to us to send to somebody else. And that actually oftentimes costs us money to administer. If they don't give administrative support, which we've been working hard last session and this session, help them understand the importance of a little bit of administrative support on the bucket 3 funding, but it helping everybody see clearly that 34.5 and 14.6 is the agency funding. The third bucket is important funding. It's doing great work, great partners, but it's not agency funding. It's funding through the agency, and to focus on those first two buckets. I think the traction has been a little bit better with that message this year. The second bucket, instead of asking for investment in the agency itself, we're asking for strategic investment population health programs that are evidence-based. Anyway, next slide, Marcus. One more and then we'll back up. Go one more slide. This is our 6 million breakdown. The areas where we need strategic investment We don't have federal funding or discretionary funding to cover. And areas of maternal infant health, which is critically important, the accessible system of care work, which is ongoing, we're making progress with the Partnership with the Alliance. That's going to be one-time funding. Our syphilis work, they help us hire staff up for until we get through this surge. The Mississippi Center for Rural Health that is being really well received at the Capitol. Our investment into our EMS work and the investment in community public health sustainability that we'll be talking more about later, and various breakdowns in those areas. And we'll, this is money that we need that will be very important for us to invest in these areas. And with the understanding that these are short-term investments, this is not increasing our budget in this area by $6 million a year, but $6 million this year, and then next, I pointed out, maternal infant's going to be a few years of work. OB system of care will be at least 2 years of work, but 1.5 will probably cover. Syphilis will be a couple, 2 to 3 years of work. Rural health has got to stand on its own when we, but this is to help us with workforce development money that we have to help really stand and center up well. The EMS services will be a couple of years of investment. The public health sustainability is going to be very short term. I expect. So they know what I hope is that next year the ask will be smaller and that we'll demonstrate a return on this investment. And then next year we'll have our business plan in place. And when we're going through our appropriations, we will say, you know, based on our health economic evaluation and the evidence that we're following from public health research, if we invest $1 million into this program, this is what we anticipate to be the return and population health outcome improvement, and also be able to translate that into positive impact to the economy. So we're not there yet, but that's my plan for next year, to show a ROI with these investments. And they're engaging with this conversation much better than last year. Any questions on this? Marcus, back up, please, one slide. This is our ARPA request. A lot of ARPA money is coming back from programs that just could not spend it. And there's hospital sustainability money going back. There's innovation money going back. And there's money from all over the state going back. We put in a request for 21 million. There's probably 150 million or so that needs to be reobligated. And we're asking for 10 million for emergency medical services, 5 million to go towards workforce development, which I've shared with y'all is extremely important. Workforce is dangerously low, and this will be a partner compliant way to invest into the future of EMS. And then another 5 million to our work in EMS to for data modernization. We have some severe needs to improve how we manage data in EMS. And then 8 million for the early intervention program to redesign the model based on task force recommendation, and hopefully to stand up the reimbursement bank for providers that we can do really one-time seed money, and then 3 million to go into the county health department sustainability program, our redesign of community-based public health. And that was actually Lieutenant Governor's team asked us to put that in. They knew what we were doing, and we're back again. And thought that we've had strong support with our ARPA ask. It's the ARPA, our ARPA ask from the speaker and Lieutenant Governor's teams. And we are working this. So this definitely use y'all support. Senator Polk on the Senate side is running ARPA, and Chairman Oliver on the House side. Thank you. Next slide.
As far as the request, legal legislative session. That's what finalized that, yeah.
Yes.
It was certainly quite good.
Any questions on the appropriation process? Y'all know how it goes. The, our academic partnership program, that's off to a very strong start. We have partnerships developing with MCPA program, USCM, Jackson State, Mississippi State. I'll be at the Ole Miss Public Health School in 2 weeks. We're having very strong interest from its CT-based residency programs, which we incorporated with the county health departments as location, including Carlton, discovered that the new nursing program established in Oxford. They're interested in rotating through. We have a family medicine program in Greenville and Meridian and Gulfport that we're formalizing MOUs for, and a lot of interest in it. And several other programs as the county health departments with our super plans, which is great clinical platform for teaching family planning, STI, HIV issues, TB, things that folks in training don't see very much of. And we're also, the schools of nursing looking for pipelines for employment in the future. So we're very pleased with Anna Lambert's work in the academic affairs office. We have internships and fellowships under development. UC School of Medicine plays rotation coming through, working with us. The School of Population Health has, preventive medicine has rotation coming through. It's very pleased. Wanted to update y'all quickly. We have 2 performance improvement projects going on. One is related to CON, as y'all we discussed in January. And if you remember, I said I can guarantee you we have opportunity in that department and have confirmed that we do. But Melissa Parker and her teams at CON are working with Wayne Jerome. Wayne, thank you for stepping up. Wayne, his team been very helpful on these BI projects and really looking at the whole process of CON that we control. And we're already pushing to get off paper and get fully electronic, and it's really smooth out the whole process and things that we control, and that is well underway. We have a performance improvement project with early intervention that's ongoing. I think very soon we'll have a new director for early intervention that will help stabilize that fairly nicely as we continue to work with the task force for the new models for dealing with three calculated development. And Mr. Chairman, I would be happy to answer any questions that y'all have.
Good questions. I'm very pleased to see the academic, the formalizing our academic program. It's the Department of Health has always been such an important learn to utilize it to improve the skills of say citizens and physicians and nurses. It's very important, and it also introduces this part.
Absolutely. And it raised awareness of what resources are available. Marcus, go back to the mobile unit slide just very quickly, please. We'll have the mobile, our first mobile unit is delivered and wrapped and ready to go. And Marshall and Victor's teams are working on our best ways to deploy them. We have a lot of demand for it already. We have another full unit that we'll be ordering, and then we're going to, instead of doing any further larger units, we're going to order 2. This is with federal funding. We're going to be ordering 2 sprint units, which are much smaller, can deploy much more quickly, and in areas that are a little bit harder to get to. But on the left is one of the OTB mobile units. And so we have a long history of mobile units. I don't have a picture of the old HIV STD unit. That we wore that one out. But our new, generation of mobile units will be used in everything that we do. We use in disaster response, so we use empty screenings, will be used in HIV, STD, work, it'll be anything that we're doing, it'll be available for use, for agency wide. We're actually back to school. We're gonna take one of the mobile units, but they're usually online shooting, I'm told. And we also have, Marshall has inflatable shelters that are air conditioned. We used a voting for last year, Vital Records. And we're gonna take the mobile unit and, erect one of the portable inflatable shelters with air conditioning and facilitate the Vital Records work. Make things with faster, so even with Vital Records, what you use, and of course, everywhere it goes, it's flying the flags for public health. And that is it, Mr. Chairman, thank you.
One other thing, the Office of District Physician Office,
Yes.
which is a very successful program in developing medical residencies around the state. The legislature wanted it with us, and they approved it, and has that been finalized?
Okay, it's, at the governor's office, we were approached, would we be willing to receive it? And Dr. John Mitchell, with retirement, and discussed that it's really leaning heavily to rural health support with our community-based residencies. And the legislative leadership was interested. I told we weren't seeking it, but I thought it was a good fit for the Mississippi Center for Rural Health under Dr. Jennifer Wilson, that we'd be happy to receive it and invest in it. And Dr. Woodward was supportive, and so it has, that bill has passed and is waiting for the governor's action. I've talked to his staff to kind of take them through the process of how this got there. And so,
Well, that important office will be here, and it'll also probably help our workforce, development of workforce strategies.
yes,
In the rural side.
and they will talk more in a bit about moving towards, instead of just being departments, moving towards true centers of function. The centers from the Mississippi Center for Rural Health is our first. It'll have the Office of Primary Care, we'll have the Office of Physical Workforce Development, the Office of Research. And then anything else that might come later would go within that center directed by Dr. Wilson. And we have one more I'll be sharing with y'all, executive session as personal matter.
Excellent. All right.
Going well.
What other questions?
You mentioned the radiologic health is not regulated for $1,000 residency, which Steve knows, you got plans of breaking your. Are there other departments that are being analyzed that may be fee-based to determine where they're operating?
Yes. Yes, sir. And the ones that there are two sets. There are fees that are Board of Health regulated. And like we came to y'all last year with a need to increase the fees on CON work. And even if we doubled the fees and it cut my losses in half, it's really all we could do. We couldn't ask for much more than doubling. They don't cut our losses in half, but they're working to push overhead down to try to close that loss in CON. And then we have the statutory fees, and this is one that's by statute. And and the real impact has been the required changes and upgrades in that program by the NRC to get us out of the compliance struggle that we were in 2.5 years ago. Requires some significant investment, and it's a fairly small increase. It'll be 25%. We're allowed to do up to twice in 4 years. We'll come to y'all, that you'll be doing the increase. We'll propose it to the board and you'll review what we're bringing, but we can't go more than 50% in 4 years. And even at that amount for the individual providers, it's a very small number, but it's enough to get us out of the hole and stop that bleeding in that program. And we, you know, and I'm working with Sharon and especially Melissa Parker, walking through all those fee-based programs, making sure that we're healthy. And then also putting the expectation, y'all, we can't wait till we're underwater, we gotta be projecting. You know, with support health fee, we need to bring those to you every 3 to 4 years to keep up with inflation. And not wait till we're in the water for 3 years. The same in the statute, you see more difficult. We tried to get it moved to Board of Health, but they declined. But they were very receptive to increase, they just wouldn't move it to the Board of Health.
Right.
But that's a very perfect question.
Dr. Waits, do you have any questions?
No, thank you. That's a very full report. I appreciate it. No questions.
Thank you, Dan.
Thank you.
Excellent report. Sharon Downey, do you have much to say today? I know we're in the middle.
Just if you had, any questions for Sharon?
We just like to see you and hear from you, maybe a sentence or two. I know we're kind of status quo.
Just 2 additional comments. He's covered everything great. So we are also working on the match for our local government rural water systems improvement board. So we have to match the federal funds. So part of that is in our appropriation bill already. And so they'll have to make up the difference that we need either through additional state support funds or bond bills, which we don't last, but we are fully boarded and we'll get that money. We also are doing a review of our revenue cycle. That's going to start in the next few weeks. The revenue cycle, of course, is what is handling all the patient billing type things from our county health department. So that's really critical that we make sure that what we call the back office is working the denials and correctly giving insurance to make sure we are getting the most revenue that we can in. And, you know, other potentials for more efficiencies, outsourcing parts of it. So that will be happening starting in the next few weeks as well.
And that's also our conversation in January, strategic planning about where are we with revenue cycle. You know, in my opinion, it's still in its infancy, but it's so complicated with 86 county health departments just have visibility on it. I think this will be money well spent to evaluate it and give us best practice recommendation whether, you know, we need to staff up more, invest more in ourselves, or if we need to outsource it, or even a hybrid. And do you think we'll have a report by July?
I think so.
Give y'all some insight by July.
And I'm sure you noticed the construction outside. That's one reason we were going to let y'all, we were going to bring the mobile unit if that had not been there, but that's for the roof on this building. So I'm sure Dr. Edney is very appreciative. He does not have a garbage can in his office anymore. That work should.
Water feature.
That work should finish, I expect, within the next few weeks. I hope that work will finish and then we'll move to the next project with DFA that they're helping us with.
So was it a new roof or?
Completely new roof on this building. They stripped it down to the concrete barrier. And then architects looking at the structure around the perimeter. We're fixing the roof, and DFA also has some additional money in their budget to address the windows on this building. They also leak, so the roof itself is not going to fix that problem, but it will minimize some of the leakage, hopefully. But they also have some more money to fix what they call an envelope issue.
It's very good. They're helping.
Yeah.
Well,
The roof is
we pay for the roof out of our funding, so just FYI on that. We did pay for the roof ourselves. They did receive additional funding for the windows for this building. The next project we have with them will be the elevators in our garage. We have paid, we're getting a new elevator. We have to pay for that as well. So
You said funding, we get additional funding.
we did not get additional funding. So it's any excess. I shouldn't say excess, we really don't have a lot of excess, some cash balances we have on hand or some general funds that we have available at the end of the year. We sometimes will go ahead and give those funds over to DFA to put in like a bucket, we'll say, so that they can pull from that for these expenditures. We have stressed over and over and over, we cannot continue to put money into these buildings. They need, not millions and millions, they need to get funding as well, which is hard. I mean, they get the funding to try to cover all the state-owned buildings and IHLs and all that stuff. We have stressed to them, we cannot keep funneling our own money into these buildings because it's taking it away from the good work we need to do in public health. Oh, I think I gave out like 700, I say gave, I should have, $700,000 for this roof. Maybe it was more than that. Maybe I may be getting that one confused with the elevator. The elevator is like 700,000 for one elevator. Roof maybe.
Pay 600,000.
Is that right? I don't remember my, so many numbers.
It leaked last night.
Well, it now another, one part is leaking, not on your floor, but one part is leaking, so the builder, the roofer is looking at that. The architect changed something, so
And then share with the board about the garden.
the little house, we call that the little house. So, the Women's Federation building is this little house right here on this corner. That is a state-owned building that DFA currently has under their purview. They are going to, assign that to us in the future, so that we'll have additional space for, offices, as we are actually, it's a hot commodity on this campus, we are out of space and we need more space. They put a new roof on it, but their new roof is leaking, so I'm not taking I'm not taking possession of that building until they have it fixed. It's a few more months, but they have to get ITS involved to get cabling and wiring from this building over to that building for our network capabilities.
What's the square footage?
That I do not know. I think it's gonna house, when we looked at it that day, probably 11 or 12 people. I mean, it's a big building. The back half is like, was set up as bedrooms, and every room has its own bathroom. It's got a fancy kitchen.
From the 1930s.
Yeah, it's solid wood floors. I personally don't know, I don't know if I would want to sit in it. It's the sound is going to be really echoey. But it's not bad.
No, that's a great asset.
Yeah, so we can't do any changes to it. I mean, it's what it is, what it is, where we're getting it, but it's on this. But at least they reached out to us.
Get back in service.
Yeah.
We need it.
Yes. And one more, and I meant to say, I do anticipate, hopefully, it's gonna have to be by the end of the year again, the work on our pharmacy that's gonna be built out in the back of this Underwood building, which is the old building. And we have a special, countermeasures, we call it warehouse that's out in Pearl on the same property as surplus property that will be built. That was ARPA money that went to DFA to fund our specific projects. So that will start, I think, by the end of the year, because they've been asking me a lot of questions.
The issues at the lab, are they with water issues? Is that?
Where is that, Stephanie in here? Have you heard,
So-
I don't hear anything. on
No,
that.
we haven't made any further progress. It's still, the project is still open. The general contractor had declined the project that we had proceeded with originally, so they just have hired a new contractor. We had a visit from the new contractor about a month ago, so the project is starting again. They believe that it will happen in the next year or two. There will be a change though. I believe the intention is now to do the envelope repair starting from the north side stairwell and coming across so that they encompass the whole tuberculosis lab at one time. We're trying to get them to do the whole front, but that's still on the table. But we believe it'll be that they'll start the project in 2 years.
So we think it's going forward.
We believe it's going forward.
But if you can just get one day that's going forward sometimes with this area, it's like one baby step at a time. Okay, so. Anything else for me?
One other question. We can catch up there longer than I thought.
I know, I started talking, he's getting me talking.
All right. Next item on the agenda is the board regular actions, which is a consent agenda, which is supposed to be non-controversial. And so we should approve all 6 items unless there is something that looks like a board member would like to extract it and discuss. But if there is nothing controversial, there's a motion, and there's a second.
Anthony, you have to call.
All right, any further discussion about our consent agenda? All right, all in favor, say aye. Any opposed? All right, we've done our work. New business, is there any new business that any of the board members would like to bring to the board? All right, in old business, we're gonna have some committee reports. Dr. Cheney, will you give us a report on our fraternal input committee?
Yeah, I would say that we're still on the steep part of the learning curve on, yeah, I would say there's been ample discussion on the problem. I think we all know the problems that we have in, maternal infant health. We're really learning about the available resources in the state of Mississippi. I mean, you know, there are resources where those are utilized to their best, you know, in the best way. That's, you know, something that we still need to find out. We've had some really good discussions. Dr. Sutton and Dr. Edney talked with us about health equity. Very much a learning exercise for me. Certainly, Dr. Catherine Brett of the Division of Medicaid discussed some synergies that we have since we're sister agencies. And Dr. Dobbs talked to us yesterday, engaged in perspectives. And so really where does our committee fit into this bigger picture? And I think we're still trying to figure that out. But I think we're making way.
I thought that was a strong committee.
Yeah.
We're learning. Any questions for Dr. Cheney?
This is Thad, if I could speak up.
Yes, that.
Yeah. Pat, thank you for that report. wanted to report, I just came from the American College of Cardiology Convention, and we have a health equity task force that is becoming a standing committee of the college. And I had the opportunity to present what we're doing in Pat's committee, and especially the thought of having a system of care for this. Everybody was impressed with what we're doing in that area. So onward.
Onward. Well said, Thad. All right, Dr. Carlton, can you give us a presentation of what our EMS committee is up to or what's going on?
Well, the EMS committee has not met since our last board meeting. There's been a lot of activity behind the scenes. I think we had talked previously about the governor's EMS task force that met November, December. They rolled out a paper with their recommendations on it. It was not adopted by the governor. It was presented as a consensus document, which it was not. And governor had representatives there. And I think there were probably multiple issues with why it was rejected. But that kind of cleared the floor for things to move in other directions and really try to build a strong consensus in how we proceed from here. I will tell you all that Dr. Edney has done an unbelievable job getting up to speed on this subject. We always joke about herding cats. This is one of those where that's an understatement because you have a bunch of different groups with competing interests sometimes overlapping, and trying to bring everybody together. And that's kind of what happened with the governor's task force. Trying to bring everyone together and get a product that is what we want and can live with for the next at least few years. It's going to take a good bit more work and input from a lot of people. Dr. Edney has met with key players with the little activity, and I would say unfortunately done by the legislature this session and the collapse of the governor's task force. I think we're poised through the Department of Health to now roll out what really needs to be done. There's going to be a lot of work and a lot to report to you on the next in the next board meeting, but stay tuned. And I don't know if you feel you've been the one so heavily involved in some of those works.
I'm very pleased with the leadership of EMS Bureau, with Melissa Parker is working closely with Teresa Wyndham, who's now over at EMS, and they're working very closely with me. We were able to meet with the governor's team to make sure they understood that we understood the concerns and already had a game plan on our own to address many of those concerns. And we're actively working clean some of those issues up that frustrated you as serving as previous MSAC chair for a long time. And Dr. Carlton has been exceedingly helpful in teaching me and giving me the historical perspective, and also being a voice of reason at peak times. And he's been engaged with, and to have now with him being Board of Health and Rick still participating and helping us with MSAC shows everybody that Board of Health is engaged, and that y'all, that I have really tried to raise awareness to the board and this session to the legislature. The governor's team is well aware of really how much need there is with the EMS system as a system. And that we have to not just invest at the agency level, but we got to invest at the system level.
Right. And just kind of follow up on what Dr. Edgy was just saying, EMS advisory is meeting Friday. And a lot of these changes will be presented to them, begin to be adopted through that pathway. But the other thing I think is important to understand is Mississippi is not the only state that is dealing with some of these very same issues. And I'm not just talking about sometimes dysfunction or whatever within EMS, just from manpower issues. It is a critical situation pretty much all over the country. And a lot of groups are looking at how to solve it. I think we've got some ideas that'll be a component of what we are doing as well out of the Department of Health. But I think we'll see a lot of change. This is also something that will have to be succinct. We can't just implement some policies for now and then walk away from it. This is going to take a long-term effort.
I agree, and that I'm excited about the future of EMS, but it's going to be a short. We have a significant challenge ahead of us, but what we do.
And it's a much more fragile system than most people think.
Much more fragile, and I wish there were a quick fix. If there were, I'm sure we've been meeting on the legislation much harder. But there's so many pieces to this that I won't take the time to even start listing them here. But very fragile. I think it's fixable, and I think we can make some major changes that will help a lot in the very short run. Some of this is going to take a little.
Dr. Waits will meet with us Friday, representing Board of Health, but also the Mississippi Healthcare Alliance with all of our system care work. And they have data to present that's going to back up what we're trying to achieve and what we do it. Again, this is an example where the community is so helpful. And expertise into this space.
Just to amplify what Dr. Eddy was saying, we love what we've done with our systems of care in the state. I mean, you talk to people in other states, and we've been ahead. After we got past trauma, and I don't mean that negatively at all, but then started adding stroke or stimulating stroke, and now additional ones. I don't know of another state that is at the level that we are, but each system of care we add on puts additional burden on the EMS. And so trying to balance that is a challenge. But that's why there's so many aspects of this that are going to have to be addressed.
There'll be several action items for y'all to the July meeting. That's kind of the EMS advisory council work.
Very good, good work. Any questions? If not, I was going to give a brief report from the ceiling committee. Since our last meeting, the legislature's been discussing a lot of reform. I may let Mr. Perry discuss briefly that, but we are planning to have the ceiling committee is going to have a stakeholders hearing, sort of gathering, and try to create sort of an advisory group about some potential ceiling reform that can be accomplished before within the department and also over the next year. So there's some activity there. Mr. Perry, are you aware of anything else that we need to let, since I lean on you on that committee, some of the legislative stuff? There's
public versions of
bill includes some of the stuff that we talked about. Working with the, I think, pass the House and we pass the Senate that had a reverse appeal in it to therefore it's going to move forward with the Congress. I think it just is also not legislative. It's limited.
What's interesting is Barry, the vehicle for that is basically taking the board of health recommendation that y'all absolutely find in January and moving your recommendation through this, it's been pretty well received.
So I think it does show that if we can look at an issue as a board very seriously, action and results, and really for that issue is really just the beginning. I think us looking at it, yeah, and trying to understand the complexities of change with it will be helpful for the legislature. I think they'd be receptive to that.
I think that's right.
I don't think we have any reports from audit or legislative committee.
About that, and his staff has done such a good job, they had needed us, but you know, I've talked to them a couple of times, and if we need to get involved in something, we'd be glad to.
Very good.
I'm gonna have you talk to your good friend, Kevin Reed.
All right.
He was a-
Any other old business that any board members would like to bring up?
Mr. Chairman, I apologize. I need to introduce Dr. Renee Dotson. Dr. Dotson, stand up. If you would. Dr. Dotson is our new Region 4 health officer for the Delta that I have described what we're doing with the core Delta counties and developing a fourth region. And Dr. Dotson is well known in the House of Medicine in Mississippi. She is a colorectal surgeon who has lived and worked in Greenville for over 20 years and reached out to me with her MPH and with interest in coming to the health department. So proud. That didn't happen every day, right? But basically, I asked Dr. Dotson just to look to fresh eyes at how a region should look administratively, and especially with the unique challenges of the Delta. She has done that in magnificent fashion, and just really appreciate her, how much of the agency and the good work she's already done to help us. We can start reorganizing the Delta. Just want y'all to speak her.
Dr. Dotson is extraordinary perspective in mine. We are so blessed to have her. We expect great things. All right. Anything else in old business? We do have an executive session. There's nothing else for the regular meeting. We need a motion to go into closed session to consider executive session, which involves litigation and personnel matters. So that. All right, we are now, the meeting is closed, and after the executive session, open session. In executive session, we did discuss litigation personal matters. We did approve also a new organizational chart. No other the next board meeting dates are July 10th and October 9th. Board members are invited upstairs or lunch. And is there a motion to adjourn? So moved. As indeed is done.
Thank you.